My name is Dr. Luis Annoni. I am a cardiac electrophysiologist. We're here at the hybrid lab, the first hybrid lab of Florida that combines a cardiac cath lab with an ambulatory surgical center. We opened this lab about 3 months ago, and a group of 11 physicians that got together, 3 of them are electrophysiologists, and 7 are cardiologists that do coronary as well as peripheral interventions. We got together to put this lab here in Florida. Most people, what they have is a regular cardiac cath lab. Here we have integrated an ambulatory surgical center, ASC. The purpose of doing that is to be able to do the EP procedures, new implant of devices, pacemakers, as well as defibrillators, with the ICD and pacemaker changeouts. What this also has allowed us, as we're starting to negotiate with all the private insurances, is that they want us to do electrophysiology studies in this lab, which is a plus. As I understand, we'll be the first lab in the state doing that. And also we have started with the interventional cardiologists doing outpatient coronary interventions. That is completely new. There is no other place that does that. And you cannot do that in a cath lab setting alone. Medicare doesn't contract with you on that setting to do EPs or to do coronary interventions. So by having an ambulatory surgical center attached to the cath lab, we're able now to offer those services to the community. If this would have been a cath lab only, you can get it from ground up probably around 6 to 9 months. When you add the ambulatory surgical center services to it, it's a very complicated process that the state as well as federally, you have to pass a lot of evaluations and certifications to get your CMS and Medicare approved numbers, which are strictly required before you can negotiate with the private insurances. So I would say that making this an ASC increased the period time to do the facility for about a year to a year and a half. But again, at the end, it's significantly more advantageous because it allows you to negotiate with all these contracts to give a full range of service, cardiology and EP wise. The credentialing is complicated. You know, it's in a cath lab, credentialing is simpler. You can get it up from the ground, up in maybe 6 to 9 months. ASC is much more complicated. The state, you have to pass a lot of testing and credentialing by the state. Also nationwide, federal, you still have to pass a lot of also credentialing. Every step will allow you to get to the process where you get a Medicare CMS number. And that is the final credentialing that will allow you to then negotiate with the insurances to get a contract. So it's a very complicated steps here. It's not so much hurdles, but time period. It's very complicated. The engineers, architects, and everything, they have to be meeting with the state all the time to be sure that everything meets standards for them. So even though, as you're seeing, we only have one room, and this room sometimes is using for cath lab, sometimes for ASC, this room has to meet all the credentials of ASC, which among them you have reverse or airflow in the room to decrease the risk of infections. And there is a lot of steps that have to go through, starting with architecture. From there to engineering. Engineering, they would be coming here 5, 6, 7 times over a period of 18 to 24 months to evaluate each step and give you a clean bill to move to the next step and do it. So it's a tedious and complicated issue, but finally at the end has worked very well. We've seen in the area, we've seen where medicine is going, and medicine is going to giving great service to patients, give great service to the community, combined with a lower cost for the government in Medicare as well as for the private insurances. And what we have seen is now with this facility, we can offer this community the best service, similar to the one you're gonna get in a hospital, or perhaps even better, because right here the turnaround is quicker. Patients are scheduled to come in, go home. They get really, really happy with it. But also doing this in a lower price for the insurances, so it's a win-win for everybody. This room is very easy to reconfigure depending on the procedure you're gonna do. You know, most of the procedures of coronary interventions, electrophysiology studies, and all of that, you are you're standing by the right side of the patient, so then the monitor is rotated to this area. When you're doing pacemakers and defibrillator, you stand on the left of the patient, so everything rotates to the other side. You know, when you're working in an outpatient facility, speed, accuracy is extremely important to be able to move the patients quickly and safely through it. And the X-ray, the Shimadzu X-ray machine is very easy to rotate around, so it speeds up the way we move patients. Also, the monitors are extremely easy to move around. They are done electrically and automatically, so it's really, really easy. We're extremely happy to be able to offer to this community the wide range of interventional, peripheral, but to me it's dearly the fact that we're going to be able to offer electrophysiology services to it. As I understand, we're going to be the first one in the state of Florida that will be offering to private insurances electrophysiology services. We expect to be doing full electrophysiology studies, ablations of most arrhythmias. Probably we will not do the ones that are longer, that can hold the cath lab for periods of 2 to 3 hours, but most of them, flutters, supraventricular tachycardias, diagnostic EPs, VTAC in normal heart, PVCs, ablations, all of them are easy enough, where we three electrophysiologists have a lot of experience in it, and be able to perform them over here. The physicians here, we go to 3 different hospital systems in the area where we've been exposed to all the other competitors. And I will tell you that we are surprised to the max. The details that you get in this X-ray are extraordinary. I can tell you from my particular standpoint, when I am implanting a biventricular device, the first time I used this equipment was very interesting, because I stepped on the floor and I looked at the image and I went, is this Cine? Did I step on the right one or not? No, you're doing the right thing. It's incredible. You can get the details of the angioplasty wire going inside the left ventricular lead into the coronary sinus. You see the tip. Certainly, it's a combination of factors. It's not only the quality of the Shimadzu equipment, it's when you also attach that to a 60-inch screen that is extremely versatile and allows you to enlarge the picture without losing details. You know, sometimes when you enlarge, things get a little bit grainy. No. When you enlarge it here, you see exactly, once you've done that coronary sinus angiography and you see the veins, you know exactly where that tip of the angioplasty wire is going to. You can see nicely the LV lead running through the wire. So we are super excited. Very interesting. Today, for example, we got a new anesthesiologist giving patients anesthesia here, and when he saw it, he couldn't believe it. I mean, he come over to me and says, even the defibrillator and pacemaker, you see all the little details of the electricity inside the device. So it's extremely, extremely good. I've heard from my partners in the interventional side and peripheral side that it helps them to speed up the case because of all the details they're able to see.